very important effect of teleradiology. So in our organization, which is headquartered in Bangalore, we have an office here in Hyderabad as well as in Delhi and Europe and in the United States, and one center in Israel. We have basically implemented certain innovations which we find have been very effective in solving certain issues. One is a single reading center covering multiple hospitals. So from one site, you can have, for instance, we cover about 100 hospitals worldwide. Many of these are in the United States. And it allows us to have an efficiency of scale. Because one radiologist, instead of having one radiologist at each hospital, a single radiologist can report for multiple hospitals at the same time. The second thing is by bringing images from a nighttime situation to a daytime situation, we make the radiologist more productive, because if you're working during the day, you need less time to recover from your work day. So your radiologists are much more productive. Having applied this model in the Western world, we find that the same technology and the same process can be used to reduce turnaround times in Singapore. And the next frontier is parts of Asia and Africa where such radiologists simply don't exist. So this is essentially the model for emergency radiology. A scan is performed, say, in Boston, and within minutes the images are received at our center in Bangalore, and the interpretation is carried out. And we're talking about critically ill patients here, patients with acute stroke, ruptured aneurysms, perforated appendix. We can, I put on the slide 30 minutes, but we can actually report a CT scan done on a patient with an acute stroke within 15 minutes that has been done on the other side of the world. So this is a very, very potent tool in terms of reducing the time to diagnosis. And it is not limited to CT scan alone. Any modality, any imaging modality that is digital, that is DICOM, can be interpreted remotely. So you can see here the full spectrum from X-ray to ultrasound, CT scan, MRI, as well as nuclear medicine. Having applied it in the emergency setting, it actually becomes easier to use it in an acute care scenario where the challenges are less stringent. And so we've been working with about 11 sites in Singapore now for the past 6 or 7 years. And before we stepped in, it took them 3 days to get an X-ray reported from one of their polyclinics, because somebody actually had to carry films from the polyclinic to the hospital radiologist. Once teleradiology was implemented and extended to our center, the turnaround time for these reports was 1 hour, was reduced to 1 hour. So the patient could actually leave the clinic with a report rather than have to come back a second time. So a tremendous impact on productivity. And you can see the results from the increase in the numbers over the years. And of course, it's important to keep the report accuracy high if one is to make any kind of impact. The third situation where teleradiology makes its impact is in the remote areas, where many parts of India have a situation where the equipment is there. The district hospitals have CT scanners which are sitting idle because no radiologist is available to report the scans. Ultrasound machines are available in many parts of the country, but not always is there a specialist radiologist who can interpret the scan at the time it's performed. And of course, the cost of transferring the patient to another site is extremely high. So teleradiology is able to bridge this gap, but to do that, it has to do two things. It has to be of low cost, and the second thing, it has to maintain the highest quality. So we are trying to do this in our organization between our technology wing and our foundation, which is a not-for-profit entity. And I'd like to show you some examples. Ultrasound is one situation, particularly in the field of echocardiography. Here's an example in this video of an echocardiogram being performed at a small hospital in northern Karnataka. And using an ISDN connection, this is a video phone where the images are being transmitted, and these can be reported remotely from our site, from our reporting center in Bangalore. So ultrasound and echocardiography are tools that can be readily interpreted remotely, as long as the technologist has been appropriately trained. Second thing is in the area of CT. We're supporting a hospital. This is just one of the hospitals, one of many hospitals we support in Arunachal Pradesh, which serves a rural population, a tribal population of about 1 million. It has a CT scanner and MRI scanner. There's no radiologist there who has the time or the experience, the expertise to report these modalities. So they've been sending the scans to us for the past 6 years, and we've reported over 10,000 CT and MRI scans for them free of charge. Another tribal hospital in rural Karnataka, which has a high HIV and tuberculosis population. So a lot of their screening radiographs are digitized. They were not able to afford a high-end DICOM scanner, so we've been able to manage with a simple flatbed scanner, which is not the greatest, but it's better than nothing. So there are many situations where teleradiology really makes an impact. To date, we've read over about 3 million scans for hospitals around the world over the last 10 years. And in many, many situations has it been able to really impact on patient care and transform the quality of healthcare delivered. But the long-term strategy cannot simply be to provide the service. One has to increase the pool of radiologists who are available to report these scans, because otherwise the problem will keep increasing. So one of our solutions is e-learning, and we have been piloting this using a technology that we partnered with Cisco to use, and it's a teleeducation portal. You can see here a talk that I'm giving showing a live demonstration of a CT scan, discussing the interpretation online, and this can be accessed simultaneously. As I understand, this conference is also being broadcast to different locations. The same can be done for medical education at a basic level as well as a subspecialty level. So distance learning enables the use of a global faculty. Your faculty can be anywhere in the world, and we have speakers from all over the world speaking at our sessions. It can be interactive using the newer tools, and it also extends your reach, of course, to all parts of the country. So I think it's a very, very potent tool, especially when you're faced with significant physician shortages as we are in radiology. Teaching websites also have a very important role to play. This is ours, but there are many such, and they can collect information, organize it, and present it to practicing radiologists as well as postgraduates across the world. This is where we stand as of now, but where do we head? Where does teleradiology go in the future? And I think this is now the new frontier, which is mobile teleradiology. We have pretty much overcome the challenges of in-office teleradiology, and now we're into a new era where high-resolution mobile devices can be used for on-the-go interpretation of scans, which really extends the reach of the radiologist and the clinician. This is done using the internet cloud and high-speed wireless broadband. Today, the viewers are sophisticated enough, or at least some of them are, which allow us to view an actual DICOM image on something like an iPhone or an iPad. Not just snapshot images, but actually images that can be windowed and zoomed, measured, and so on. So all the functionality of a desktop workstation has now been brought into onto the iPad and the iPhone. Having the images stored on the cloud makes a big impact. It allows for easy access, extreme redundancy. There's no question of a server going down or your cable being cut and so on. It's also a significant cost savings because of the ability to pay for just as much as you use rather than have to pay for a large upfront infrastructural cost. And this has all been enabled by the onset of 3G wireless broadband, which is radiology is all about large files being transmitted, and the higher your broadband connectivity, the better your broadband connectivity, obviously the more impact you can make in the clinical arena. So the advantages of taking teleradiology mobile are, of course, that your diagnosis now becomes immediate, instant. It's highly portable. I can be carrying my iPad around wherever I go, and if I get a call asking me to give an opinion, I can immediately log in and look at a scan. Obviously, it increases radiologist productivity because now there is no downtime. You're basically working all the time wherever you are. Some may say that's a disadvantage, but it depends on how you look at it. And the collaborative approach is, as we see in this picture, clinicians can also use this technology for collaborating with radiologists and discussing scans on rounds and so on. It's also used therefore, to enable more accurate and early treatment delivery. And the training opportunities are significant. So in conclusion, I would like to say that teleradiology today has already established itself in healthcare. It has a critical role in emergency diagnosis and has a huge potential role in serving underserved parts of the country and the world. The new frontier is mobile technologies, which allow for even more immediate diagnosis as well as for e-training. And I think teleradiology today is an example of the potential success of all telemedicine, provided it is operationalized effectively. The technology tools are available to us. Now it is up to us as clinicians, I think, how we use them to greatest effect. Thank you very much.
That was a pretty interesting field. I wouldn't call that as anywhere closer to the next wave of the IT which picked up India about 10-15 years back. I think we are in the cusp of medical industry as a whole taking up or adopting IT, taking it to the next big leap, so that you and me, whenever we go for an X-ray and say that, you'll have to come back after 3 hours to collect the report, or it is available in the desk at counter number 6 or counter number 7 after 3 p.m. Our next speaker is my co-chairman. Dr. Ramakrishnan, he's a senior consultant in critical care and sleep medicine, and he's the director of critical care services across the entire Apollo Hospitals, Chennai. He holds his medicine from Stanley and then practiced in UK and the US before he returned back to India. Welcome, Doctor.
Thank you. I think you're going to hear the second doctor talking about similar problems and somewhat similar solutions. Quality and standard are truly becoming buzzwords in healthcare, not just now, but probably for a couple of decades. And I just wanted to start off with this report from the Institute of Medicine in the US in 1996. And when we all look up to the West for high-quality healthcare, a surprising jolt that came from this report titled "To Err is Human" was that there was almost over 100,000 deaths related to medical errors that were happening in the hospitals. And this report said that Americans were dying from these preventable medical mistakes only in the